Identification of the cephalic structures, which are sensitive to pain, is essential to understand the pathophysiology of primary and secondary headaches. Our knowledge about intracranial pain-sensitive structures in humans comes essentially from animal studies and from the pioneer Ray and Wolf study in patients undergoing awake craniotomies. So it is currently accepted that these intracranial pain-sensitive structures are limited to the dura mater and its feeding vessels, and that small cerebral vessels and pial mater are insensitive to pain. However, this is inconsistent with some neurosurgical observation reported during awake craniotomy procedures.
In 1940, Ray and Wolf studied 30 patients undergoing awake craniotomy, describing extra and intracranial pain-sensitive sites and their corresponding referred pain. They reported that pain could be induced by mechanical or electrical stimulation of the dura mater and the proximal centimeters of large cerebral arteries. At the opposite, similar stimulation of the pial mater and smaller vessels did not provoke pain. This study has never been challenged or reproduced since 1940, except by one study where only the dura mater was stimulated. Consequently, it is currently accepted that in humans, the pial mater and the small cerebral vessels are insensitive to pain, and that intracranial pain-sensitive structures are limited to the dura mater and its feeding vessels, the large venous sinuses, and the proximal part of the large cerebral arteries of the circle of Willis. This pain insensitivity allows to perform painless intracranial neurosurgical procedures in awake patients. However, neurosurgeons performing routinely such awake craniotomies sometimes report that mechanical stimulation or microsurgical handling of these structures might induce brief and acute intraoperative pain. Despite their rareness, this observation suggests that pial mater and small cerebral vessels might be actually sensitive to mechanical stimuli that induce pain and consequently might be involved in the pathophysiology of headache. To address this question, we collected prospectively observation of painful events induced by mechanical stimulation of intracranial structures during awake craniotomies performed routinely for intraoperative functional mapping to tailor resection of tumor located in eloquent areas.
Data concerning the location of pain-sensitive structures were drawn by the surgeon on a template, and their corresponding referred pain was indicated by the patient by drawing a cross or a dot on a diagram representing the head. In this observational study, the authors collected prospectively 93 reports of acute and brief pain events evoked by mechanical stimulation of intracranial structures. They confirmed that dura of the skull base and dura of the fork cerebri are sensitive to pain, and that their mechanical stimulation induce pain mainly referred in the sensory territories of the V1 and V3 divisions of the trigeminal nerve. But unlike the seminal study and the current opinion, they observed that small cerebral vessels and the surrounding pial mater were also pain-sensitive, and that their mechanical stimulation provoked pain referred in the V1 territory. These original findings suggest that small cerebral vessels may be involved in the pathophysiology of primary and secondary headaches.